Okay, so we're here at the Care Show and I'm with Richard Ayres, who is Social Care Advisor at Care England. Richard, what brings Care England to the Care Show this year?
I think the Care Show is probably one of the main events of the year. It's one that we like to come to every year. We like to meet all of the different sort of supporter members and suppliers to the sector, and to really kind of engage with our membership and those who are not members of Care England yet, and talk to them about what their issues, concerns, problems are, and understand the trends, etc., of what's going on in the sector.
And are there any particular sort of services or products you're promoting at the show in particular, or is it just the general sort of range of services that Care England supplies?
We tend to have a solution that solves every problem. We try to find solutions with case studies that solve every problem across the sector with good, strong return on investments, a reason for why you want to solve those problems. The main one that we're kind of showcasing at the moment is Smart Care Intel, which is a solution to manage quality within residential, domiciliary, supported living, shared lives type services. So really a way to understand how your quality can be compared to what the CQC would expect it to, the standard is expected to perform to. And we are promoting sort of mock inspection routes so within the tool, what good looks like, what outstanding looks like, how you can solve problems just by asking a nice, clever AI, giving it a problem and getting to give you a solution from a ring-fenced environment of what the CQC would probably say about something.
Oh, right, okay. So is it, when it comes to what members are actually talking to you about, is it CQC inspections that sort of loom the largest?
CQC is one of the core problems. I mean, workforce is always a problem. We've got a huge issue with losing our domestic workforce quicker than we can retain them. We've had the plug pulled on international recruitment. So our international workers, who are saviours of our sector, have been pulled from underneath us, so we're going to start to see those issues come down. We're all concerned about the rise of agency coming. It's at its lowest point now for a long time.
Right, okay.
But we expect that to kind of rise over the next coming couple of years. We got the Employment Rights Bill, the Fair Pay Agreement, that are in process, and consultations just out, more consultations coming. They are huge costs to us as a sector from a workforce perspective. So that's workforce. From a quality perspective, the CQC is changing. They are starting to listen to the social care sector, to adult social care, and they're making changes. They're reviewing the quality statements, they're reviewing what they do, how they do things, how they engage, how they train their staff, how they collect information. They've really listened to the feedback of the DASH review, the Richards review, and the Care Provider Alliance, and the work that we've done to support that, and their own other kind of networks to really make changes. So they are two big things. And then the other thing is just financial sustainability. Costs are at the top of where they've ever been, and providers need to figure out how can they reduce those costs.
And how can they? What are the main routes to doing that?
I think one of the main things, this is probably why your guidebook's probably quite good, because you can only control what you can influence, and you can influence what you purchase. I'm a procurement professional of 30 years, that's my background.
Right.
So really, for me, when times have troubled over the years, whether it's been investment banking, aviation, or healthcare, when trouble hits, everyone looks to procurement to try and reduce the costs and save money. And that's where we come into our own. We look at our environments, we look at the goods and services we acquire, we look at efficiencies, cost savings, benefits, digital technology enhancement. I mean, digital tech is the saviour to compensate for some of the issues we've got with recruitment. So that's what we have to do.
Excellent. And in terms of government, now what could the government be doing that it's not doing at the moment, or what does it need to be doing more of?
Well, look, we've calculated that we believe the gap between what care costs and what is paid at a local authority ICB type level is about £5 billion gap.
Right.
So there is no plan to close that gap. So what could they do? They could start to create a roadmap that closes that gap. They can support us on the care workforce pathway. They are starting that, but we need to give the workforce a pathway and something to aspire to. But we also have to consider that the Fair Pay Agreement and the Employment Rights Bill are going to help with retaining staff, but it's not going to solve the problem. There was a brilliant report done by Cohesion only a couple of weeks ago, and it reported that pay and benefits is number 5 on the list of why people leave the sector.
Oh, really? Okay.
450,000 people left the sector in the last 12 months. That cost over £3 billion to recruit and retain them for a year.
Yeah.
Now, what government could do is help us to really find practical solutions for retaining our staff, so we didn't have to keep recruiting and seeing the same people moving around chasing a penny here or 10 pence there per hour. That's what government really need to focus.
That's-
They need to get their ducks in a row because they're very disjointed. They're not joining all of their strategic directions together either at the moment.
Yeah, it does seem that way. So, into practical solutions such as
I think funding, career pathway. They need to sort. They need the Department of Health and Social Care need to really kick the Home Office up the backside and sort them out and say bring back our international workforce because they are what's going to save our sector.
Yeah, totally, yeah.
If you want to create a social care sector that's fit for the future, we need international workers because they are fantastic. They work so incredibly hard. They compensate where we've got gaps in our workforce, and they're incredibly loyal to us. And they have saved us in 1945 after the war. They've saved us many times over the years. We need them. So that's what government really needs to be thinking about doing.
perfect. That's great, Richard. Thank you very much. Appreciate
pleasure.
that. Thank you.
Thank you.
Cheers.
Cheers.